Next up, we have PainChek, ASX code PCK. PainChek is a digital health company that offers a mobile app for pain assessment using AI to analyze facial expressions and other indications in patients unable to communicate verbally. Presenting for the company today is CEO Philip Daffas. Philip, thank you for your time. Over to you.
Thank you, Abby, and good morning, everyone. I just want to present today the actual quarter results for PainChek, which was just posted on the ASX last week, and I'm going to use slides that were posted on there as well. So next slide, please. So PainChek as a company has a responsibility and has a focus on giving a voice to people who cannot verbalize their pain. Pain assessment is difficult, especially for those who cannot communicate effectively. At one extreme, this means people like adults, people with dementia or cognitive impairment who have lost their ability to communicate effectively. On the other hand, pre-verbal children have not built those communication skills as yet. In both instances, if pain is not assessed properly, this can lead to undertreatment or overtreatment of the pain. And in some cases where there's a wrong diagnosis can lead to mistreatment. So we've developed PainChek technologies using AI and smart automation to address both these issues and both these vulnerable groups. Next slide, please. The PainChek technology is a really simple product to use. It's an AI-based, regulatory cleared product. It's a medical device that comes in the form of a mobile app, and it's compatible both iOS and Android smart devices. The assessment process is rapid and simple for any trained carer. First, the PainChek app accesses a mobile camera on a smart device to conduct a 3-second AI scan of the face to analyze and document the presence or absence of 9 facial features that indicate pain. These indicators are often too complex or too subtle for the naked eye. These indicators, we then take these indicators and then we guide the nurse to add their clinical observations of pain through a series of guided checklists. The PainChek app then combines the AI and the care inputs to provide a pain score, a pain severity rating ranging from known pain right through to severe pain, and a unique pain profile of the resident that's really proven to be very valuable in pain management. This is a great example of how AI combines with human intelligence to help nurses and carers provide better care for their residents and patients. And this is one of the reasons why we're getting such great take-up and significant market acceptance and commercial penetration to date. If you look at the markets we're servicing, they're large and significant markets, and they're global markets. If you look at the aged care market, which we're now very well penetrated into, or in Australia and the UK, for example, there's around 6 million beds globally, which when fully penetrated, has a value to us of around $300 million. We've only just done 1.5% of it so far, with a long way to go. The home care market, we estimate to be up to 10 times that size as more and more people want care in the home and more governments and technology actually transitions care into the home. We do have an aging population globally, and therefore home care and technology to assist it will become massive, and we've already started to penetrate that home care market. The infant market for pre-verbal children is larger than both of these two. They actually have 400 million pre-verbal children at any one time, and 150 million born to first-time parents each year. Parents who struggle with care of their infants, we can provide them with the pain assessment tool to manage care at home. And finally, both the adult and infant products are suitable for the hospital market, where we've already started, and include a partnership with the company with InterSystems on a global basis. Next slide, please. So if you look at the size of our market's pretty significant. Oh, sorry. So go to the next slide, please. I've just covered that one. Sorry, next slide. So if you look at our penetration to date, then we're doing really well. If you look at our Q1 highlights for FY25, we've actually succeeded really well in our 3 core business areas. Firstly, we just successfully completed our FDA de novo clinical validation study and now submitting the results to the FDA for US marketing clearance. We're on track to become the only regulated pain assessment device in the United States market, and that's a market that's worth up to about $100 million per annum. And we also, as I'll show you, have key partners in place to actually penetrate the market. Secondly, we've continued the acceleration of growth of commercial licenses within our key markets. We've reached 100,000 contracted global license mark across Australia, New Zealand, UK, and Canada, and close to a $5 million ARR, which when fully implemented takes the company to an operational break-even position. These licenses are not just aged care, they also include home care sales and hospital sales, validating the broad market opportunity for the business. And thirdly, we're now pleased to confirm the market introduction of the infant technology through an early access program directed up to 200 parents of infants to test the product with them and finalize the market entry strategy in early 2025. We also have agreement now with the Apple App Store to actually supply the product as a standard app through them for our broad market launch. Next slide, please. This shows you the growth of the business over the last year. As you can see, we've had, with those 100,000 licenses, are actually spread across more than 1,800 aged care facilities in the UK, Australia, and Canada. We have the 4.8 million ARR represents a 30% increase on previous year. We're getting strong gross margins, 80 to 85% range, and high retention rates, which again are around that same 85 to 90% mark. So all key factors of the business are going in the right directions. Next slide, please. This slide focused very much on the utility of the products, and utility is really important. This is a unique aspect as we document every single pain assessment conducted in an aged care facility or in the home care or the hospital. We've got more than 7.5 million pain assessments conducted to date, doubling the previous year number, and it's a unique database to PainChek. This is a key indicator that reflects strong continued use and strong clinical use and directly reflects how well we're implementing and utilizing the product. So again, a great marker. Next slide, please. If you look at the Australian business, where there's now more than 61,000 contracted beds, that's more than 30% of the aged care market, which is, again, we're the largest, most popular clinical tool used in aged care, covering more than 750 aged care facilities. And we seem to be very strong in those larger groups. As the market consolidates in aged care, the larger groups are going fully digital, and we're the only digital medical device to assess pain. So that's where we're at the strongest. And in addition, we have partners in place, distribution, and we call the care management system partners, who also supply aged care. And with them together, we can access close to 3/4 of the total Australian market opportunity. So strong position in sales and strong growth pipeline. Next slide, please. If you look at the UK market, we've got a similar position. We're now at 39,000 contracted beds, again, doubling sales year on year and 9% growth in the quarter. And that's a value of around 2.1 million Australian dollars and less than 10% still of the UK market. The last quarter, we've successfully implemented Oakland Care, 1,000 beds across 10 homes, Berkeley Care, 800 beds over 12 care homes as well. And we've also got new integration partners. You can see them up there on the bottom left, Ascom, Camascope, and Care Control. Again, these provide access to about 400,000 of the 500,000 bed market in the UK. And they're starting to do co-marketing and reselling to speed up the sales process. Next slide, please. Really, in summary, the reason why PainChek's doing well, and look, I've been working in this sector for many years with Roche Diagnostics and diabetes and with cochlear implants, and we're delivering the 3 key components. One, we're providing an unmet global medical need in terms of pain assessment for those who can't verbalize. Secondly, we're improving health and clinical outcomes with a number of published papers showing how we're delivering those outcomes. And thirdly, we're showing cost benefit. We're reducing the use of costs of unnecessary drugs and pain relief products and other clinical benefits. So if you hit those 3 key benefits, which PainChek is doing, you have a validated global significant market opportunity. And on top of that, we do also have patents on our product. Next slide, please. I talked earlier about the FDA. Just to reiterate, yes, we're submitting now in the next couple of weeks our documentation for the FDA clearance. It's under the de novo clearance. The results from the study were very, very positive, which showed a comparative performance with the comparative Abbey pain scale around pain intensity agreements and retest reliability, which were the primary endpoints agreed with the FDA. In addition to this, we'll be submitting the papers from these results for publication and also for submission at conferences in the US in 2025 as part of our US market entry strategy. Finally, the point is that we get this first, then the PainChek Adult app would also be a predicate for new products from PainChek, including the infant product into the US market under a much faster route. Next slide, please. Finishing off on the FDA and the US markets, we're very pleased. We've got 3 partners in place to rapidly enter the market, with probably the biggest one being PointClick Care. PointClick Care cover 1 million beds of the 2 million beds in the United States. We have an integration agreement with them already, and we've already started selling with that partnership into Canada, and we'll be ready to go when we get clearance for the rest of the United States. Next slide, please. So just last couple of slides, meet PainChek Infant. Yes, very delighted to say that we're actually starting now with the infant technology and entering into that large market, global market. The infant product is actually similar to the adult, but it's a more fully inclusive app. We do a 3-second pain assessment analysis on the face to pick up the indicators of pain, but we also monitor the historical pain events. We document all medical treatments, including medications, to enable sharing those results by the family, with family members and their doctors. The app is self-guided in training, so it's fully inclusive and it's very user-friendly. So it's effectively a plug-and-play product that will be available in the next few weeks on the Apple Play Store. We're now in that early access. Next slide, please. We're now in the early access program. We're actually recruiting up to 200 families. We've done more than 50 already to validate the utility of the product, to refine the pricing mechanism, and then to go live in a broader audience in Q1 2025. Next slide, please. So just to finish off, thanks to our shareholders for ongoing support. The company is now generating real cash to fund the business, and we're demonstrating strong top-line growth with significant growth opportunities. In the past year, we've invested in the FDA trials and in new technology upgrades. Those are one-off investments that won't be repeated, so R&D costs are now coming down. We're expecting an R&D refund of 1.2 million in the next weeks, and no debt and strong sales growth. So I'll hold it there for any questions. Next slide.
Thank you, Philip. We have had a few questions come through. So firstly, how do your apps compare to assessing pain in comparison to a human?
Well, there's 2 types of processes. Firstly, if a human can actually verbalize their pain, if a person can verbalize their pain, if they can call self-report, then that's the gold standard. So you, Abby, if you say you're in a pain, it's a number of 6 out of 10, and it's coming from that's the gold standard for assessing and documenting pain. But we're targeting people who struggle to communicate, people with dementia, people with cognitive impairment, who have lost that communication ability and therefore can't verbalize reliably. And the other extreme, pre-verbal children who haven't built those communication skills as yet because they can't speak or they can't communicate effectively. And those are very significant large markets, and that's where we focus on.
Understood. So if you launch into the US and Canada next year, what effect will that have on your revenue?
Well, firstly, we're already in Canada because we have Canada Health clearance. So we've already sold it to a number of Canadian clients. So that's already happened. In terms of the US, well, let's put it this way. The US market is 10 times the size of the Australian market. We've got to 30% penetration of the Australian market quite rapidly. If we achieve 30% penetration at the same time of the US market, that's about $30 million US. So we would go significantly. We go from our 5 million ARR to go to well past break even for the business, but also to a high level of profitability for the business.
Also on revenue, so you mentioned the infant app, which is launching on that Apple App Store. What sort of revenue are you expecting over the next year or so with this app?
Yeah, we don't project revenue per se, but let's put it this way. If you look at the size of the infant opportunity, so there's 400 million pre-verbal children, 150 million born each year to first-time parents. If we penetrated just 1% of that infant market globally, that's worth the same $300 million as the aged care market. It's a significant market. And look, I did diabetes monitoring with Roche. I was the head of global marketing for a number of years in Germany with their blood glucose monitoring business. It's got that similar sort of size and scale opportunity because it's a home-based test. You manage your care at home, you treat effectively at home, and therefore it takes pressure off the healthcare system, it takes pressure off GPs, and it gives a better tool for mums and dads. All mums and dads have baby monitors, they have thermometers. Now they can also have a pain assessment tool which completes the whole care and management of children in the home environment.
And could you talk about any plans for expanding to Europe or Asia?
Yes, absolutely. In fact, some of our partners in the UK that we have, I mentioned one earlier called Ascom. They're actually a European-based company. We've got an agreement with them already in the UK where they're present, and we've got an integration partnership with them, and we're now looking at a potentially reselling partnership with them into their home base, which is the Netherlands, and they're also present in Germany, Switzerland, and other key markets there. So we're working with those partners in Europe to expand our presence into Europe. In terms of Asia, Japan, we will go to Japan once we've finished our FDA clearance because the Japanese regulatory authorities take FDA data, and therefore we'll take that data with us to the Japanese authorities. And again, Japan's probably the second largest market in the world for aged care, and they've got a very sophisticated system there which we're looking to penetrate.
And Philip, do you have any competitors, and how hard would it be for another company to train AI for pain assessment?
Well, there's a few things. We have no competitors to date, which is great. Secondly, we have patents on our process, which means it's very difficult for someone to copy the process we've done without infringing the patents. And those patents are in place in the US and in Europe and the UK up until 2038. So we've got a good lead, we've got a clinical lead, we've got a know-how lead, and we've got a technology that we believe is unique in that process. So we believe we'll be first to market in the US, first to market in Europe, and we're taking all the learnings we've done in Australia, in New Zealand, and the UK into those markets.
Thank you so much for your time, Philip. A fascinating presentation. That's all we have time for today, but hope you have a great weekend. And yeah, we'd love to get you on in the new year as well.
Thank you, Abby. Thank you, everyone, for listening today.